Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network. Chris Holman here. We're coming to you from our studios at the Capital Region International Airport. We're going to stay in mid-Michigan, run way out to Okemos right now. We're going to spend a little time with Laura Appel, who is the Executive Vice President of Government Relations and Public Policy with the Michigan Health and Hospital Association. Laura, it's always good to have you on. How you doing?
I'm doing well. Thank you so much for inviting us.
Let's do a quick little primer here for those who don't know what MHA is and does.
Sure. So I often refer to the Michigan Health and Hospital Association as the Chamber of Commerce for hospitals. So our members are everybody that you know of that has an emergency department in Michigan is our member. We also have membership from inpatient psychiatric hospitals and rehab hospitals. And so we are engaged with advocating and supporting our hospitals across the state.
Excellent. You do some wonderful work too. A lot of advocation. And of course, the last couple of years, that's been really important stuff. You also do a little research. Now, your MHA 2025 Community Impact Report just came out yesterday. Can you give us a little brief overview of the report?
Sure. So we do this every year, and we are really excited about our 2025 report because not only do we have some nice numbers in there that will help explain statewide the impact of our hospitals in their communities. We've divided it out by community this year, as well as the support that we have for the state as a whole. Overall, Michigan hospitals invested more than $4 billion in our community benefit activities, and what specific programs are outlined in this year's report. And you might wonder, like, well, where does that $4.5 billion go? We do a sizable amount of work with health professions and supporting them, healthcare support services like transportation and food. We do health, community health and clinical research as part of that that investment as well.
Laura, I think this really speaks to the enormity of the health industry in the state of Michigan and what a big part of this economic turn it really is. I mean, there's a lot of things you do, not to mention the economic spillover of employees who come to work and they eat locally, and just the cash flow of the whole thing. It's a tremendous industry, it really is.
Absolutely.
All right, so how does this work? All this work you're talking about impact Michigan communities from an
So,
economic?
I know that your audience is focused on the business people, and thinking about, like, well, what does this mean for them? And let me give you an example of the incidence we have of diabetes in Michigan. And I'm going to use this example because one of the stories that we have in this year's report is about the University of Michigan Health Sparrow mobile clinic. And that mobile clinic goes to different areas around mid-Michigan, helping people who need healthcare and don't have other access to it. And they have found in serving people when they go out into the community, they've identified what we call dormant conditions, things that people have but they don't know about or aren't really showing up. And for conditions like diabetes and hypertension is high blood pressure. Now, why is that important to the business community? So diabetes makes a huge difference in terms of the economic impact in Michigan. And of course, it is people with diabetes have medical expenses that are greater than 2 times higher than people who don't. But let's get right down to the bottom line for our employers. Michigan spends about $2.7 billion on indirect costs from lost productivity due to diabetes. So if you're an employer and your employee population has a high incidence of diabetes, it's really costing you in terms of lost productivity, in addition to those higher healthcare costs of your employees.
I was so hoping you were going to get there because in the back of my mind was, what about time off? And this is the importance of having an annual physical and having things looked at because there are things you don't diagnose on your own and they have to be found there. Uh, about regarding this, what are the big takeaways that you hope people have from this report?
I hope that they will understand that your local hospitals are making significant investments in your community wherever you are. It's not even limited to our not-for-profit hospitals that are required to make these investments as part of their tax status. It's required, or not required, it's part of what hospitals do. And our investor-owned hospitals are part of the contribution as well. And if you need services, if you need help, talking to your hospital leadership in your community about what they're doing to help throughout your community, whether it's transportation for people who are seriously ill and can't move themselves around, or if it's helping people who are pregnant and have a better experience with their pregnancy, they're there for you.
They certainly are. And thank you for being there with us today to straighten out this report. We appreciate it very much. Laura Appel, she is the Executive Vice President of Government Relations and Public Policy for the Michigan Health and Hospital Association. Laura, again, thanks so much for your time.
Thank you.
You're watching the Michigan Business Beat on the Michigan Business Network. I'm Chris Holman. We'll be back.